So I'll use that as a transition. And next we have Francis Kaklauskas, who I'm so grateful, who's joining us while visiting his son in his freshman year of college. So just so grateful and happy to have you be here with us. And just to keep things rolling, I'll give like a very, very brief intro and feel free to add anything that you'd like. Um, Dr. Kaklauskas is an esteemed clinical psychologist with over 30 years of experience in a large variety of roles and settings, including private practice, community mental health, forensic psychology, educational, professional, societal leadership. I could go on and on. He's an associate professor at Naropa University and Saybrook University. He's the past president of the American Psychological Association, so the APA's Society for Group Psychology and Psychotherapy, 2023 to 25, and editor and author of one of the authoritative books on Buddhist-Informed Contemplative Counseling Approaches, which is titled Brilliant Sanity, Buddhist Approaches to Psychotherapy and Counseling. Usually I'd have that right here, but I am teaching right now at Naropa and I bring it with me to class on Fridays. So it's in my car. But I'm so grateful to have you here, Dr. Koklauskas, and I'll turn it over to you.
Um, Thank you, Brenna. I think people have done a lot of listening today, and I put my PowerPoint in the chat. I'm hoping people can see it. And it seems like people have a lot of familiarity with Buddhism and a great familiarity with the research and the different theories in mental health. So my practice now generally is just leading groups with clinicians, either therapy groups or consultation groups. So I thought maybe I can jump to points in my slide, but maybe people would want to join, put their cameras on and say how the conference is impacting them or anything they would like to learn from this next hour that I get the lead. But I think it might be nice for people to get a chance to talk. This is why I do groups, because then I have to, it's a lot less pressure. I'm surrounded by a lot of smart people who, particularly with clinicians, they bring up a case and I say, oh, what do others think?
Thank you. We're streaming this on our Facebook event too, and I'll read. We've just got some comments coming in. Appreciate the patient-centered care, knowledge in the field. Very excited to learn about Buddhist approaches. Are the three big comments coming in. Yeah, Heather,
I'll
go
raise
ahead.
my hand. I'm so excited for this. One of the biggest compliments I ever received, I was moving apartments in New York City, and we had some guys who were actually helping us. It was very nice. I highly recommend having help. And one of them was packing up some of my stuff, and he turned to me and said, "Are you a Buddhist?" And in the middle of this craziness, and I was like, oh, I hope to one day be able to say honestly that I could say yes, but it was just this moment of, oh, you think that? So I'm just very excited to hear what you're going to say.
Okay. All right. Maybe I'll run through my slides and really help me not go too long. And really, I'd really like to help us be able to talk with one another. But it looks like Michael has a question or a comment to start us off.
Yeah, I'm a undergrad psychology student at Naropa, and I've got a couple of years left. But hoping to segue into a master's program and kind of weighing the Buddhist-informed contemplative versus the mindfulness-based transpersonal. So just anxious to learn a lot more about the Buddhist-informed contemplative side of things.
Okay. It sounds like people would like to listen. I want to make sure, Michael, this sounds like an exciting journey and vacation, or more like a prison term, a few more years left.
It feels like a vacation. I'm loving it so far. Yeah. Well, time will tell. Time will tell.
Just think we're working with so many people here working this field. Sometimes it's a wonderful journey and sometimes it's parole. But I'm going to try to share my screen and let's see if this works. it's nice to see so many people I know too, and also to meet so many people that have such wonderful things to say. Okay, this is working. So
Yeah, working great.
maybe I'll try to run through it, and then we'll have some time for comments and questions and integrations and contradictions. So I'm not going to talk about enlightenment, no self, or specific practices today. I wasn't talking about Brilliant Sanity, but listening to the earlier wonderful talks, I had to throw in a slide about it. And I wasn't going to talk about harm reduction. Then I felt like I had to throw in a slide about that. But I think this brings the wealth of variety and diverse viewpoints and experiences that can really help us all learn and grow. I wanted to make a little personal note. I started studying Buddhism in 1985. I came to Naropa, and then I entered kind of psychoanalytic school and kind of special education school in 1988. And when I entered those schools, I felt like I was just reading things that I had already read in Buddhism in some way. And I think Brenna already went over, I've worked in a variety of organizations, community mental health, criminal justice, private practice, intensive outpatient, residential. So my practice today is generally I just do groups with clinicians, and then I try to help people talk to each other in constructive ways. So I'm hoping to do that here. So this is a long tradition. This is maybe one of the most famous stories is William James invited a Theravadan teacher over to Harvard in 1903 and said, "Take my chair. I'll sit with the students. You're better equipped to lecture on psychology than I am." And so I think this seems like a very kind of scientifically grounded conference, which I really like. And there's been a lot of research integrating, of course, mindfulness, but kind of other Buddhist practices and what are the qualitative aspects of someone who might practice Buddhism a long time. So I think it's very, very complex, has been acknowledged throughout the conference, right? These traditions of Western psychology developed, I don't know, let's say within the last 200 years in the West with different languages and different cultures and different norms than what occurred in India 2,500 years ago. And there's not a single psychological approach, as we're hearing so much about so many different approaches today, nor is there a single Buddhist tradition and approach. My sense is that probably every Buddhist and every Buddhist teacher probably sees things slightly differently, or that's been my journey at least. So I think some of the general things they share across the Buddhist schools is this idea that life is hard, life is suffering, life is existential angst, life is feelings of incompleteness, maybe like Lacan's lack, life can be disappointing, life can be sad in some way. And I think the biggest teaching of this that someone said at my wedding, and it'll be 35 years on Tuesday with my wife, Dr. Elizabeth Olson, is that having enjoyment or success or good times doesn't mean you're doing anything right. And struggling doesn't mean you're necessarily doing anything wrong. That no matter how we look at it, life can be challenging in some ways. And then the other ones I'm going to highlight here is this idea of impermanence, that who we are or what our symptoms are at this moment may be different, will be different in the next moment. And then I'll talk a little bit about karma and particularly about practice or the experience as being a central piece. So I said this, that I'm very curious how similar contemporary American Buddhism is to Buddhism in other parts of the world, but maybe there'll be some comments or thoughts about this. So I covered this, multiple languages, different terminologies. Both Buddhist writers and psychology writers like to use the word self or ego. And we heard about Kohut earlier today. So even in the Western tradition, using the word self may have will bring up different kind of associations and different understandings. So it's amazing that we can communicate it all with one another sometimes, I feel like. but we'll try, I hope, today. So I think this has been covered a lot in this talk, but I'll run through this. I mean, I think ideally they're both Buddhism and Western psychology is really aspiring to kind of reduce suffering of other people in some way. I think they both really put a high emphasis on understanding the mind, maybe with different ways of doing it, right? I think both require many, many years or decades of practice and study. But I think kind of the overall goal as it's framed in our contemporary world is different. I think Buddhism is trying to address this existential angst would be an American phrasing for suffering, Buddhist idea of suffering. And so much of Western psychology now is about symptom reduction and not about growing people or personal development. And I think the goal is very different. I think that really the Buddhist path is about being service to others. And I think in the way it's framed in the West, although altruism can be a part of an outcome of treatment, it's really about kind of self-improvement, reducing symptoms, getting what you want, framed in this more individualistic, neoliberal, capitalist world that we swim in now. So I already said this. I mean, I'm guessing many people in here read Buddhism and read Western psychology, and I'm always questioning myself, like, are they saying the same thing? Are they not saying the same thing? And while a lot of pieces of Buddhism have been brought into kind of contemporary Western practice, particularly mindfulness, and I'll talk more about mindfulness, that many practices of I'll just stop there, and we might talk more about it. But in terms of contemplative psychotherapy, I've run across a bunch of research recently that talks about the importance of not just awareness, which is kind of a central idea of Buddhism, but that what really creates change in people is awareness and then reflection upon that awareness. I'm feeling angry, or I want to eat, or I want to disassociate, but some awareness of your thoughts or feelings or your views about other people. And then not just stopping there, but kind of contemplating that in some way. So I have at Naropa, where we teach, we work from this kind of contemplative education model. So I put in a few kind of questions here from this first person inquiry of this awareness plus reflection. What am I feeling? Why am I feeling this way? Have I felt this way before? What are my impulses? What do I want to do? If I did that, how would I feel? How would others feel? What would be the impact of that in some way? So in many ways, these are the norms of the groups I run, is that people might ask these first person inquiry questions as they sit in group and they notice what's going on with their mind, and then hopefully they'll share some of what is happening internally for them. I really like to put an emphasis, which has been stressed through this conference so far, of second person inquiry. How can I deeply listen to others? How can I get closer to really understanding their experience in some way? Can I go beyond the natural neuroscience pathways of just categorizing others into intersectional identities or experiences or symptoms, clusters, and diagnosis, and really listen for the complexity and the nuance where things may fit and where things may not fit in some way. And I think there's a pull towards other people are our teachers, right? I hate this personally because it's said over and over in the Buddhist literature, is that the people we struggle with are often our greatest teachers. And it's probably true. I'm not sure if I experienced yet, but I trust the lamas and Rinpoches more than myself. I'm still a work in progress here. And then third person inquiry, we kind of combine our experience, right? The famous Buddhist quote of don't believe anyone, any expert, unless it fits with your own experience and logic and rationality and critique and critical thinking. But I think it's really important to know, what do the experts say? What's the research say? How have these ideas been critiqued? And then I really like this idea of what may be missing when we're taught, we just get into these kind of meta narratives or even little silos of thinking in mental health. And then how can we try to break out of that and really repeatedly ask this question of, what may we be missing in this topic, or clinically, what may I be missing about a client? So I think my Buddhism, my contemplative psychotherapy is different than others, but I really see that kind of a root is this contemplative work is really not trusting much in oneself in others, that always being skeptical, curious, and humble, I would say. So Brilliant Sanity came up. I was going to skip it, but it comes from this Sanskrit word, which I'm not going to try to pronounce, but I'll try to explain the idea. So this is an idea that's kind of a structural idea of the mind that can draw comparisons to the endless amount of structural ideas of the mind from what we heard earlier today, Kohut self-skills, or Freud's tripartite ego, id, superego. And there's endless structural ideas in Buddhism about how the mind works, and this is one of them. But the idea is basically that inside of us, all human beings kind of have this ability that is kind of more open, spacious, and we're not just automatons on habitual patterns, that there is some ability to slow down and reflect and be open. So we can see whatever thoughts come through our mind as waves, or the popular metaphor of clouds moving across an endless sky. And trying to embody this view is better than just kind of being rigid and hanging on to, this is what it is and we're going to do it this way, which has come up repeatedly in the conference. The second idea is this clarity or wakefulness and kind of awareness beyond our patterning in some way. So inevitably, as we get stimuli, we start going down our habitualized patterns, and Buddhism is what they say, or maybe repetition compulsions, and psychoanalysis in some way, or maybe default networks if we're talking about neuroscience. But can we notice when we're doing that and kind of come back to this openness? And then the idea is that through this practice and through the path of Buddhism, we do develop more compassion. And then we'll try to act in a compassionate way in some way. So this is talked about in different ways in the field. I think somehow there's in my view, kind of an oversimplification that if we practice Buddhism, that if we study our own mind, that naturally we will know what to do. And it kind of minimizes the necessity of kind of deep study and deep training, say as a clinician or as a researcher in some way. And I really lean towards compassionate action is really blended with training oneself very hard in whatever discipline they are, hopefully learning about other disciplines in some way. We've kind of covered this. There's many early parallels. In the late 1800s, the Buddhist texts were getting translated. I'd always been fascinated by what I see as Schopenhauer's misunderstanding of Buddhism as a gloom and doom kind of worldview, which it is, but there's more beyond this. It reminds me of Klein, that the disappointment stage is, yeah, we're limited, the world's limited, other people are limited, and that's the truth. But beyond that, there can be joy, there can be connections, there can be relationships, there can be meaning, there can be service. So I'll go to the last point in this slide, which is, well, early on with James and Vunt, we tried to do these consciousness studies and write everything down. That was kind of abandoned in Western psychology for this more kind of objective observation and documentation of discrete phenomena, simple cause and effect. And I view Buddhist practice more as like an experiential phenomenology to put Western language on that in some way. I feel like there's been many misinterpretations of Buddhism, not that I have the right one. And it seems like every public intellectual makes some kind of statement about Buddhism, whether it's Lacan has a famous essay about Buddha's eyes, or Zizek, or everyone likes to kind of understand a little bit of Buddhism without a lot of practice and then tell others what it is. And I'm very worried about ever doing that if I know a little bit about, say, Lacanian psychology or Zizek's postmodern philosophy. Do I really get it, or am I just trying to look smart or make myself feel more calm in the face of complexity and unknowingness? I think we've covered this, right? In psychoanalysis is the unconscious, and Buddhism, there's this idea that things are happening outside our awareness. I can think of my trip here to visit my son, who's a freshman in college, and he said basically, oh, there's this Blitz chess tournament today, Saturday, and there's a lot of family members, parents and children or siblings playing in this tournament. You should really come out and play in this tournament. I think that would be, really, really good for you. There's good players. You'll learn a lot. And I don't know whether it's in his awareness or if I'm projecting it into my awareness. I think the message is, I haven't seen you for 6 weeks, Dad. I'd like to see you. And here's a wonderful excuse that we can get together as American males do and do something together, as opposed to talking about our feelings with each other in some way. So I think there's so I've already talked about endless structural frameworks of how the mind works in East and West psychology. I really, for whatever reason, this idea of absolute truth versus relative truth has really stuck with me. That relative truth is kind of research and its theory and its language, but below all that, everything is so interconnected. And these are just the structures we've put on top of the world and have put into our consciousness. And that by seeing the world accurately is, we may not be able to do it, seeing the endless complex web of karma of history and multi-causal events in some way, and knowing that whatever language we put onto something is inevitably distorting it in some way. But then also we need a relative truth. We need to figure out where I should get gas, what I should eat for dinner, how I function in my role as a father in the example I'm giving today. That can we hold both of these? That there is a sense of self, and we have roles in our contemporary life that we can choose to kind of fulfill the best we can. And this is very relative, but there is something bigger, more interconnected happening. I often think to me, it feels like it has a lot of similarities to the whole postmodern philosophical movement. And I might be distorting that. So we've talked about this, CBT, right? We can talk about not seeing the world correctly in Buddhism, or thought distortions in CBT. I think CBD is trying to bring more attention, particularly mindfulness-based CBT approaches, which are all the rage, kind of bringing more awareness to what's happening inside of our minds. And I also would even say that while in Buddhism, we're paying attention to our thoughts, Buddhism, I can see, also has a very kind of behavioral tradition that we do these practices every day, that there's a emphasis that these will create some kind of better understanding, and that will maybe make us feel better or make us be in service to others better. And there's Western research that it does build more resilience and trains the mind and builds compassion in some way. And I also really like this idea that if you go to a Buddhist retreat center or shrine hall, it's very set up in a way to set the environment to kind of impact the mind and impact motivation. And this is found in behaviorism also in some way. They call it, one word they use is drala energy. When everything has a place and everything's in its place, we can kind of feel uplifted and more sane. For any of you who might struggle with some neurodiversity like myself, you know that's true, but you're rarely in this uplifted drala space. I think this is a very important topic, is in Western psychology with discrete objects, a lot of research is here's a symptom cluster, we do this set of interventions, and then here's the measurable outcomes of what we measured. And this is very beneficial and helpful and informs our practice. I think of a lot of talk about interpersonal psychotherapy so far in the conference. And one of the research findings that, supports this is that if we can help the client talk about the grief in their life and the challenges of their roles in their life, they seem to have less symptoms when we're looking at it from a strong Western view, but probably function better and feel happier. But so in Western psychology, there's really discrete objects and kind of simplified cause and effect. And we have to do that. It's the relative truth, the best that we can come to it. But I think in the Buddhist view, everything is so hopelessly interconnected that it's hard to really be completely certain that we're capturing all the most vital factors, and that what we're studying that seems to have an impact is really what's having the impact. I think there's been a lot of discussion in this conference that it's really the relationship and the care and the understanding and the exploration and therapy that happens more than any one specific technique that we're applying, going way back to the dodo bird theory that most psychotherapies seem to have similar outcomes. I said harm reduction. I think we've heard about this already. Meeting the moment, getting off our script, being realistic. Let me say a little bit about mindfulness. So mindfulness seems very, very helpful for individuals, particularly in Western psychology, and working with a variety of symptoms. Depression, anxiety is probably the biggest empirical support for this. But really, the goal of mindfulness is about kind of this self-improvement. And mindfulness is now being implemented in corporations so people can be more productive and make more money and maybe exploit people more. And also a mindfulness program for snipers, so they shoot better and have less trauma symptoms and are better able to disassociate from the impact of their actions in some way. So that's a very different kind of guided mindfulness towards a specific outcome, where I think Buddhism is really looking at doing good in the world and helping others. So it's much bigger than just practicing mindfulness in some way. There's an ethical aspect of Buddhism that may not be seen in mindfulness. Relates with the humanistic traditions. I don't know if I'm forcing these similarities in here, but Buddhism, we're thinking about what are we doing, what's important, and we do this. And ACT, that came up earlier, existential traditions. So Buddhism, if it's kind of grounded in serving of others, it's grounded in social justice in some way. And when you look at what Buddha did in a very kind of caste system in India, invited people of all gender identities, and there were gender expansive people in Indian culture at that point, into the Sangha, and kind of it's open to everyone. Everyone can reach enlightenment. It's not just for the Brahmin in some way. And then as Buddhism spread, and Buddha had some patriarchy in his thinking, giving his time, Buddhism has gotten into many patriarchal cultures where we're still decoupling that from Buddhism, and we're seeing more teachers with more complex and non-dominant identities. So I'm almost done, right? I think the integration, we shouldn't just read it and then apply it in some way. A lot of discussions about, as mindfulness is appropriated from Buddhism, might we do that with Buddhism in other ways? And then I'm really curious, is Western Buddhism, or is it its own thing in some way? There's my dyslexia showing up. But I'll say a little bit about my journey. So I think, having practiced off and on for a long time, 40 years or something, I really do feel like over the years I feel more compassionate, and also open heart of sadness is a word Trungpa said, that seeing my son is joyous, and there's a deep sadness that I'm going to die and he'll be on his own and I'm only here for a few days, and how cute we were together when we'd cuddle in bed when he was 4 is different when we're sleeping in 2 double beds in a hotel room and he gets a break from his dorm room. I feel like I have much more sympathetic joy for others. It's unnerving being trained analytically, and I should have this great aggressive drive that I should master, and I should feel revenge and all these type of feelings. But I feel like there has been a big growth, that I really feel happiness when others are happy. I feel like, it's kind of, Buddhism is kind of a path of humility and not knowing. So helped me get over myself more. I feel like just watching my thoughts come and go in meditation has made me overall less reactive. I feel like I have more ease with life challenges and, these existential givens of life truth, better tolerance for not knowing or ambiguity or complexity. I'm not fighting to fix that all the time. Maybe I've had a few in my decades of practice moments where I'm touching a little bit on what they say is like cool, better, bigger awarenesses in Buddhism. I obviously don't know, and none of my teachers will tell me, which I think is the right approach. But in no way I didn't talk about enlightenment. Don't feel like I'm any way near enlightenment. And I still have lots of feelings and attachments to really wanting things the way I want them to be, but it seems like I'm accepting what is a little bit better. But my question to close with, when I think of myself, and you can think of yourself, so I've changed from the time 1985, that was 40 years ago, from the time I was 21 to now 61. And was it the Buddhist practice and study? I went through more than 3 decades of individual and group psychoanalysis. Was that the causative factor? Is it just history effects and getting wiser with age? Is it something we're not looking at? How multi-causal is it? How closely could I even identify the factors that influence the way I've changed over the decades in some way? And then I made a joke about, who the hell am I to say talking about me and changes? Isn't it all no self and interconnectedness and, clouds rolling across the eternal sky? So let me stop there and see what I don't necessarily need questions. I'm really happy with people just sharing their associations, a story, whatever comes to mind in my groups. Sometimes I say this as a joke, this last line on the slide, when there's silence in the group, it's kind of mocking my psychoanalytic training. Any dream fragments, melodies, song lyrics, images, or associations coming to mind? So I'll give that as the prompt to this group.
Thank you.
And I'd love to see you if you want to be seen. And I don't want to foresee. I want things the way I want things still.
I'm happy to kind of share first and get things started, and just, boy, thank you so much. I'm so grateful for you taking the time out to share. Two things that really come up for me, and I'll go with the first one that comes up, is just as a newer teacher and researcher and kind of old but junior in my career, I still rely so heavily, I think, on kind of like scripts and structure. And I continually just learn so much from you and my student, everyone at Naropa in particular, about bringing in the experience, the experiential piece and bringing in life and bringing in spaciousness and room for connection, and these things. And that's just, it's just kind of really something that resonates with me. And I'm always reminded of anytime I'm interacting with anyone at Naropa or watching presentations of like, oh, yeah, like let's bring the humanness into it, really. And for me, it's always like a invitation for growth, always an invitation for growth. Um, and and then I'll just add like alongside of that, I don't know that I've ever been in a community that is like Naropa and like Buddhist communities where also there's such a warm reception and acceptance that it is safe to really just show up and it is safe to go off script and invite everyone in. And I think that's so special. Yeah. Um, yeah, I've got some more thoughts too, but I see Michael's got a hand up, so I'll share the stage. I'll let others comment.
Yeah, thank you, Doctor. So I related a lot to that kind of last point of there's the increased compassion, and that comes with it the increased sadness. I I found something similar in my own journey in relationship to the ego, the concept of self, the skandhas. I did my final paper last semester on the skandhas, and I got this sense of, kind of seeing how the sausage was made. Um, and that, I had this concept of self and then having it, breaking it down and seeing how, I don't have as much control of my impulses, or what I'm inclined towards as I thought I did. It's, causes and conditions from early childhood led to A, led to B, to
Yeah.
C. And, there was this point of despair of, well, then what am I? So I guess my question is, when incorporating these concepts of ego into psychotherapy, and particularly from a clinician standpoint of like communicating that to clients, is there danger in that lack of identity, or that letting go of identity, and how can we approach that with clients as to not cause harm?
I have thoughts about everything that was said so far, but other people have thoughts about this. It's a very smart, experienced group. All right, I'll say a few things. I think particularly with the topic today, we're looking at what might be the next pragmatic triage step, which might be sometimes hospitalization or a treatment program. And that really these ideas of, I think, still in psychotherapy, we're working with kind of a real relative self and kind of role functioning in our lives. So I think we might hold this view of impermanence and the deep interconnection of things, but I don't think we're forcing that on our clients, and they'll walk on their journey and maybe over the decades or years kind of be able to grasp more lightly to that. But I would love to know what other people think.
I'll maybe just chirp in a little bit. And I'll just share like my own perspective and what I do, kind of like in my health coaching and behavior coaching, which is largely psychotherapy, within my scope. And Michael's, I hope it's okay to say, Michael's one of my students. So Michael, I think, knows more than anyone that my understanding of Buddhism, I'd say, is loose, um, and held with a lot of humility. But I think in so many challenging situations, often what I want when I'm going through challenges and what I see that my clients want and what, the people who I love and know want, usually, I mean, oftentimes it's like for it to stop or for it to fix it. And then when we can get over that, if it's something where it's like that's not on the table, um, usually the next thing that we want is for someone to be present with us in it, and I can make so many analogies. And like as an ultra runner, I think I've learned this from a very young age, where it's like you're in a race and you want to finish it and it sucks. And that's a good analogy for life, and it's like what you really want is someone else there. For me, what you really want is someone else there to help you be accountable to what your long-term goal is, and to help you show up as the person that you want to show up as and be the person you want to be. And I really, more and more, especially as I really just learn more about these Buddhist approaches, just think like oftentimes the best thing that I can do when I'm trying to help someone is just show up, and show up for myself so that I can also, kind of model or teach or have some foundation of offering to my client how, or friend or whoever, how they might be able to show up for themselves in these moments as well. And just showing that that's safe, holding the space, and I think I just like always have to add like with so much humility, I'm nowhere near, perfect on any of these things. And I think that also
Maybe
can
that's
be,
good.
yeah, exactly. I think that is a benefit to share.
Uh, it makes me think of when I think back about my treatment and my analytic treatment, nothing stands out. There wasn't some like great interpretation or that she gave to me or anything, but just to have someone journey with me through life's up and downs and the weird things my mind does. And she went senile, so I had to stop after 27 years with my second analyst. But she lives on within me. Like when addressing a converse, when I have a dilemma, I can hear her saying like, well, what do you think, Francis? Why do you think that? That was kind of her.
Mhm.
I don't know if that sounds like a good idea, Francis. Please, Heather.
Just in terms of feelings, I loved the slide where you talked about the difference between Buddhism and mindfulness and how it's being used. I think that's very important. And the comment you made about, and I'm going to get it wrong, joyousness and sadness. Um, I, I think about, and again, kind of mindfulness, I think about what's being sold to people. We are constantly in all of the work and all of the therapy, you're selling something to someone. Um, and I loved your honesty of what we are selling in Buddhism is not all happy. And I think that's really interesting, again, as we talk to people about therapy, about growth, about what you're trying to achieve, to convince people, especially here in the United States, actually what we're trying to achieve is not all yellow-faced emoji happy. You are going to feel, I will raise my hand. I went in this morning and apologized to my oldest child, who I was very angry with last night. I apologized and said, you were coming in to talk to me and I tried to solve the problem. I apologize. So I think it's very, I love your honesty. It's not all beauty and ease and what it's actually all of the experiences. It's all of the heartfulness. Those were some of the things that really resonated for me. Thank you. Yes, radical acceptance.
It reminded me of what Brenna was saying about teaching at Naropa is there is a large contingent that is nice and compassionate, but there's a subgroup of people who really don't want to accept the first noble truth that we can't make things perfect, and they'll just fight and blame and I find it very unpleasant, Brenna. I don't.
I've
Please,
had some unpleasantries.
Yes, Alex.
Yeah. So I think, sorry if I echo, but I think one of the things that I really enjoy is the parallel of Buddhism, mindfulness-based cognitive therapy. And I think maybe without knowing,
Alex is helping us stream onto Facebook. I wonder if maybe you turn your the phone volume down or off.
let me try that. Is that better?
Yeah, that's
Okay,
better.
sorry about that. I think maybe like the overlap with like mindfulness-based cognitive therapy and Buddhism, how beautiful that is. And I think the discussion I like to have in like my health practice, which in some ways has some overlaps with Brenna, but I have even less, I would say, focus on mental health and more just on like holistic herbal and nutrition. But I've learned, I've been doing that for 20 years, that there's almost two groups of people, and I have never phrased it that way or that well put as you did, but I tend to notice that they're in the range of, do you want less range and a path, or do you want more range and a longer journey? And that's kind of how I've always phrased it with people. And a lot of times, you may not get as far with the people that want less range, but things might take a lot more work and be a lot bigger of a transformation with people that want the full range of things. And I tend to resonate more with those people. I have some clients I've had for a decade now, and the things I've seen them go through as I've grown too as a coach. And I'm like, oh, I can't tell you. I'm so sorry for what I told you a decade ago, but that was the best I could offer then. And, but we've grown together and we've seen things. And then I have some people that I know for 6 months, and I see them change their bodies and get a different outlook to health. But those relationships never really have the full depth, I guess. So I really liked those overlaps, and my own spirituality is very eclectic. So I enjoy learning as much as I can. So thank you.
I really like this theme of us being imperfect in our roles as coaches or therapists. And I love my analyst. It's not like she never made a mistake or was misattuned or said something stupid, in my view. But like, we grow by being real people with one another and finding the grace and finding cooperation and collaboration.
I'll just, if it's okay, just to kind of riff and add on that. I started teaching. Naropa was really my first like just me teaching experience a little bit over 2 years ago now. And I've been involved in 12-step fellowships for many, many years. And I've had other experiences in my life where I've gone from learner to teacher, or learner to mentor. And there's always, I find, such a shift when you're in the position of teaching, that it's like all these questions about, do I know enough? Am I good enough? Blah, blah, just go away. And it's like, well, here you are. So, and I've never felt that as strongly as I did, I think, when I was at Naropa. And, I'm stepping into a classroom of folks who are training in Buddhism, which I know very little about, and it was such an experience of like, oh, I'm pretty sure I'm the hottest mess in here, but I'm the teacher. Here we go, And um, I think that humility, just to kind of touch on that imperfect, I think that humility is so. I had an English teacher in 8th grade, 10th grade say the word humility comes from the root humus, which is that like moss that all life comes from. And to me, it's like humility is that thing that, on my best day, I can feel good, comfortable in it, but then it's not really humility. It's like I never feel comfortable that much in humility, but it's always where like all the good, the growth and all the good stuff. And I find that especially with my students, the more human I show up, like the better that goes. I mean, that goes over. And like like a good example, I sweat like gangbusters. I'll be like lactating under my armpits. And I call it my secret weapon because it's like inevitably I'll reach up and everybody, I'm sure everybody's noticing everything, those who notice. And it always like I think those things they just soften us, and I think they're yeah. Oh, that's my little piece. I
Yeah.
think they're all helpful.
Thank you, Brenna. Anyone who hasn't spoken, I'm seeing two of the best Naropa students I ever had in the on the screen. You're welcome to speak. I'd just love to know if you have any thoughts or resonance or story or strong disagreement.
Hugh, go ahead.
Yes, please.
Hugh, I think are you speaking? We're not able to hear you.
Hello, how about now?
Yeah, excellent.
Okay. Yeah, thank you, Francis. So I just want to circle back to Michael's question about egolessness and how to integrate that in clinical setting. And I think it's really important as a person, we are clinician and we integrate Buddhism in our practice and methodology. And for me, as a student at Naropa, I think it's really important to mention that before we can integrate the egolessness teaching, we have to come very clear on, so we need to have a self, and that self is not solid. So that is the key integration here, because if we jump into very like so fast to egolessness and to client get confused, extremely danger when they have some trauma going on and they're not very happy with the self. So having a self first, and I think that in alignment with like Western psychologies on how to do like self-care. So at very bottom that a self and that is not solid. So we have under the stat cell is under many other constructs, other conditions, and that is important to mention here in like research or professional setting and also in clinical work as well. Yeah, I just have that idea in my head, and yeah, thanks for listening. I wonder if anyone has responded to that.
Oh, Francis, you're muted.
I really appreciate it, and I think it might be a wonderful point to end on, that we can hold this view of non-self for our clients, which is kind of can give us the truth of impermanence. Things are always changing, and maybe some hope that things will not be what they are now. And by luck and our effort, maybe people can heal. So I think that's really, and a lot of our clients, of course, working with eating disorders don't feel this way, that like failed treatment approaches and hopeless and shame and right. Well, thank you. It's a wonderful conference. I'm going to pop in and out the best I can,
Thank you.
and won't take the critiques of what a stupid move I made, because my son's like in the top 0.5% of chess players in the world, and I'm good, but not like that. Like, it's usually like, Dad, why didn't you just move your knight here? And I'm like, because I didn't see that. My vipassana of the board wasn't big enough. Buddhism and chess. Take care, everybody.
Thank you so much.
All right. Thank you. Bye-bye.
Thank you.
I'm seeing a few comments here. Tracy, radical acceptance. Beautiful. Yeah, boy, thank you so much, everyone, for joining. We're at noon, so we'll take an hour break. I'll be on for a little bit if folks want to stay on and chat or ask questions, and then probably at around unless folks want to pop off at some point 12:15 or 11:30, we'll actually close the Zoom and then reopen it just so that it can so the recordings can pause and we can renew. So maybe I'll do that kind of sooner rather than later, but I'll hang out for a little bit if folks want to stay on. But we're so grateful to have you here, and thanks for everyone who's joining.
It's been wonderful. Yeah.
Yeah, thank you.
Bye, everyone.
Take care. Thank you.